Happy Thursday, everyone, and welcome to today's Fireside Chat. Today, I'm so excited because we have Dr. Jennifer Zelnick with us. She is an incredible and fearless advocate and professor, and she will be talking to us about her journey as a social worker and as a social welfare advocate. Dr. Jennifer, thank you so much for joining me today and for sharing this space with me.
Thanks, Shaniqua. It's really great to be here with you and to have a chance to continue our conversations in this format.
Yeah, absolutely. And before we go into Dr. Jennifer's bio, I would like to invite all of you to share this video out to your colleagues and to your networks. We'll be talking about some very intriguing and inspiring topics, listening to Dr. Jennifer's story and how she's really changing the trajectory of social work. And so we do want you to make sure, we want to make sure we're amplifying that message. So please share it out and also engage with us. If there's anything that resonates with you, even if you're watching this later on, we want to hear it. So feel free to comment below and let us know your thoughts. And then, as always, we would love for you to visit us on our website at www.iraisinc.org and follow us on all social media platforms at iraise.org. And also, please follow me, the CEO and founder, Shaniqua E. Moore, on all social media platforms. All right, let's get started. Well, Dr. Jennifer, I'll start with your bio. Dr. Jennifer Zelnick is a professor and social welfare policy chair at the Touro College Graduate School of Social Work. She holds a master's degree in social work and a doctorate in public health and conducts research in the US and South Africa. Dr. Zelnick is a public health social worker committed to bringing social work skills into public health research and services. Her research and scholarship investigates topics of importance to the health and social service workplace, beginning with the premise that quality health social services and successful outcomes depend on sustainable work environments. Dr. Jennifer is trained in community organizing and occupational health and safety policy. Her research is geared towards useful input into policy development. Dr. Zelnick's research in South Africa focuses on social issues and infectious disease. Currently, Dr. Zelnick is involved with training South African TB social workers on patient centered care approaches and is a part of a multidisciplinary study team investigating improvements to care engagement and health outcomes for drug resistance, tuberculosis, and HIV co infected patients, including the role of stigma, depression, and other psychosocial challenges. Her previous work in South Africa concerned the social factors that determined workplace exposure to infectious disease in the context of a generalized HIV and drug resistant TB epidemic. Dr. Zelnick serves on the editorial boards of Aphilia, the Journal of Women and Social Work, Health and Social Work, and New Solutions, a journal of environmental and occupational health policy, and as the chair of the Touro College Graduate School of Social Work Social Welfare Policy Sequence, Dr. Zelnick will dedicate her passion to engage clinical social work students from different backgrounds in the political process, social justice, advocacy, public health, and macro practice skills needed for change-oriented leadership in the social work field. Dr. Zelnick, that's so impressive. And reading your bio, I have actually learned quite a lot about you.
Thanks so much. Thanks everyone for listening to all of that. That was quite long, but I do feel like it is a good representation of what I do. So thanks again for listening.
Absolutely. And more specifically, Dr. Zelnick, your work in South Africa. So I'm wondering if you can talk to us a little bit about your career trajectory as a social worker, and then specifically in the context of your international work in South Africa.
Right. So, there's a long story to tell about that, and I promised you I would try to keep my segment short. So I'll tell the more proximate story about how that ended up coming to be. But, I have a master's in social work and community organizing. And so I've always been really aware of political transformations, community transformations. And the story of the, defeat of apartheid in South Africa is one of our modern, tales of the triumph of the people over an unjust system. So that's always held a lot of promise for us here in the US because of our own, history of racial, segregation and discrimination and such, and also around the world. So, so at the point when I went to South Africa, I was in my doctoral program in public health. So I already knew that I was interested in learning more about how the work environment impacted health, safety, and well-being. And that's a whole other story in and of itself. But I had been working for years, several years in the labor movement with nurses and looking at how changes in the work environment of nurses were impacting their work as well as patient outcomes. And so I got interested in how in South Africa, the labor movement was interacting in the post-apartheid context. So full disclosure, we have a close family member who was diagnosed with HIV in the early 90s. And the fact of the matter was that when protease inhibitors came into existence, he went from having a death sentence to having a chronic condition. So unfortunately, following the end of apartheid, South Africa was hit with an HIV epidemic, which undercut a lot of advances that were, going to be made. So my husband and I, he was a medical student at the time, went to South Africa together because we were interested in this political transformation and the opportunities that were going on there, but also because of the HIV/AIDS epidemic that was just starting, and the fact that the drugs that were saving our relative's life and allowing that person to live and be there for his children and grandchildren, we're not going to be there for people in South Africa. And it seemed manifestly unfair. And so that's how we ended up going in the first place. That initial trip led to a career for both my husband and myself in research that has come to center on the co-infection of drug-resistant TB, which is the main opportunistic infection of HIV, and the workforce that's involved in providing care and treatment. So, just to cut a long story short, my own work, which started out being about nurses and their workplace exposure to HIV, today is about involving social workers in the care and treatment of people with TB and HIV. And I work with my husband on randomized controlled trial, looking at social work interventions as improving outcomes for these patients, along with a lot of other more scientific and clinical things. So I'll stop there, but that's sort of the long and short. It's a family endeavor. Our kids have all, come there and gotten, exposed to this work. And through that, we've created a lot of opportunity for trainees in medicine, epidemiology, social work, nursing, and things like that.
Thank you so much, Dr. Jennifer. What an incredible and powerful story that I never knew. But also, what really resonates with me is it's a family sort of collective passion that you've been able to share with your children, and like how powerful is that?
Yeah. Yeah, no, I think, for so many of our students, people come into social work because of something about their background and family, something they've witnessed that they want to make right in the world, and so
Yeah.
I think for us, just being in that moment where we, went through that period of time thinking that our relative would pass away from this disease, and then realizing that there was medicine out there that could save their life, but there were structural forces and social forces and socioeconomic forces that might keep somebody from having access to this. So that good news is, over time, South Africa developed universal treatment for HIV through their public healthcare system, and they continue to be a leader in treating, infectious disease through public health system. Not that there's no problems, there are a lot of problems, but this is something that the rest of the world can really learn from. And so we're really hoping to bring social work into that more powerfully. And so I collaborate with a colleague from the Department of Social Work at University of KwaZulu-Natal. We have a small cadre of public health social workers we've been training, but we're looking to grow, these ideas to expand that workforce and also show, that it really makes a difference to be treating the whole person, not just the medical side of things, but, all the trauma, the perhaps substance use problems, the family problems, poverty, things that people are going through as they're trying to cope with these infectious disease conditions, very similar to the things we see here in New York City and around the country.
Absolutely. There are two things that stand out for me about what you said, Dr. Jennifer. And one of that is social workers belong in public health. We belong there. And it makes a lot of sense in order to change these structural dynamics and forces that are constantly at play. We must be in these particular fields. And the second thing is you talked about these socioeconomic and structural factors that were impacting the public health outcomes of South Africans. I'm wondering if you can speak to the contrast, but also the similarities that you see in the U.S. as well as what you're seeing in South Africa around these issues.
Right. So, so let me just say, like, as a 2-second detour, that, if you look at the history that's taught to public health students and you look at the history that's taught to social work students, we're all trying to own the same history, right? Like a lot of the early people that we talk about in the settlement house movement and who were involved in the Children's Bureau and things like that, those are the same folks that public health practitioners claim as their foremothers and forebearers. So we do have a shared history, of meeting the needs of populations around social issues, sanitation issues, environmental issues, maternal child health outcomes. And so that's a natural history, although I know we've problematized that history. There's a lot of folks left out of it, but nonetheless, I think it stands that there's a shared history in the structures. So, but as far as the structural socioeconomic factors, it is not saying anything that people don't know. Is that poor people, minoritized populations, BIPOC communities tend to suffer worse public health outcomes. And this is not because of behavioral issues. This is because of structural factors, which sometimes over time interact with behavioral issues or lead to, generational stressors, which can also contribute to health outcomes. There's a lot around this, but so this is true in the US and it's true in South Africa. And one of the things that's different in South Africa is, the majority population was a disenfranchised population for so many years. So, that's something that's different because here, we're talking about, minoritized, but segments of the population that suffered, discrimination and oppression and go back to having a legacy, in some cases of being enslaved people or displaced people. In South Africa, they were certainly displaced people. And so that marginalization in the social structure that can lead to poverty, can lead to, lack of access to healthcare, lack of access to generational wealth, generational trauma, all manifests in generations going forward. And we have this concept of the social determinants of health here. And, I think these same social determinants of health come into play. And so I'll just say one more thing, like in terms of the HIV epidemic, we were familiar with that epidemic as an epidemic affecting gay men primarily, because that's how it came to be publicized. But, that story, that narrative obscures the fact that early people who were coming in with these infections that were unknown at the time were, intravenous drug users and were communities of color. And as, treatments become available and things have become much more legitimized, the actual AIDS epidemic, people that are still presenting with this, horrible disease, has settled down into the most vulnerable populations, right? People who are not accessing care, people who are stigmatized and not taking their medication for some reason, or who don't have the support to do so. And even though in South Africa, the disease is much more generalized, you've always had a heterosexual spread, it's sort of across the population in many ways, but not always. It still tends to settle into those most vulnerable people. So drug addicts, people without family stability, young women who have experienced sexual abuse when they're young, people that have lost their parents to HIV. So there even within a generalized epidemic, there are these critically at-risk subpopulations. And that's, I think, the lens that social work brings, that we need to be looking out, for all people, and especially those people that are stigmatized and vulnerable. I hope that answers your questions, but I think that the things that comprise vulnerability are, and we can look at that through epidemiology, which is a public health technique. the things that comprise that vulnerability are the things that are similar across the two countries, and it's where public health and social work can come together.
Thank you so much, Dr. Zelnick. That's exactly my next question. And we're looking at these two professions essentially. We talked about the shared history that we have as social workers and public health professionals. You being the chair of the social welfare policy. Did I get that right? I may have butchered it a little bit.
Yeah.
Um, However, you're really you're bringing that lens, that social work lens to public health. That's so important and so vital in such a way that I believe we need to see it broadened in our field and social work. And wondering if you can speak to how can public health professionals and social workers collaborate on a better level, systemically, or
Mhm.
collaboratively together, and maybe it starts in institutions, but how do we work together across curriculum and community and policy when we're making decisions at the table? What are some examples of us being able to work together to deepen our impact and move humanity forward?
Yeah, no, it's a great question. I think, there are many programs out there that train public health social workers. I know locally, Fordham has a joint program with Mount Sinai training, social workers get an MSW and get an MPH simultaneously. We don't have that here at Toro. There's a great program at BU up in Boston. So there are programs that are modeling that. And I think, there's so much going on there, but I think, one of the things that's the crux of the matter with bringing the two together is that, public health has a commitment to the social determinants of health and also population-based health. So understanding health issues as facing populations, not individualized, westernized medicine, but prevention and population interventions, and that can go to things like you know uh, health literacy and vaccination and all these good things. And once you get into those things, you very quickly get into the person and environment, right? So I'm thinking about how, just as a quick example, one of my students years ago, she's an Orthodox Jewish woman, and this is a time when that community was facing many measles outbreaks, and there's a lot of controversy about vaccines and measles. But one of the things she wanted to do was bring some education to the community about these issues so they could really ask their questions and really become heard, because often these women are the health decision makers in their family, especially for their children, and they're ferocious advocates for their children, and they're smart. And so, she created this event that brought together, frankly, a lot of vaccine advocates and people from the city and people that would like to say, you need to vaccinate your kids, but that's not how you can address people to make change. So this was about meeting people on their turf, letting them get their questions out there, respecting their culture and community, and trying to bring, a change that we engage in together, which I think is the real community organizing, person and environment lens together with the public health information and literacy. So that's one thing. I think, I work a lot with the city around tuberculosis here in New York, and we have some serious issues with, unfortunately, the New Yorkers who are coming from TB endemic countries. And a lot of the policies making people switch shelters after 30 days and stuff could create a huge crisis of transmission of tuberculosis. So it's something we're really concerned about. But I know, we've placed students in social work at the TB clinics, helping to deal with the social issues that prevent people from engaging in treatment, helping the people who are being diagnosed to understand, what is this diagnosis? What does it mean for me? How do I interpret it? There are a lot of ways that our ideas about meeting community where they are being championed in the public health department. So having social workers there can really help. So those are just a few ideas. I know in South Africa, they have a lot of graduates who graduate with their degree as social workers, and we want to create a career path for those students to come into the public health system there. They have a lot more jobs than we have in public health in South Africa, potentially. So we need to prove through research that it makes a difference, and then hopefully we'll have good students to bring into the workforce.
That's incredible, absolutely what you talked about. Social workers again belong in those spaces, and I think one of the challenges is how do we create those pathways for students once they finish their studies, and what does it look like for them to pursue these public health as a potential career? I think the pathway is somewhat unclear and ambiguous in many ways, and but it seems like you're blazing that field for us.
Yeah, no, I think it's true. It is ambiguous, but the only other thing I would say is that the public health view on many of the issues that we deal with really resonates with social work, and that is an opportunity. So, for example, one of the clearest directions that we have in substance use issues is harm reduction. Harm reduction is like an idea that came out of public health. It's about letting people live another day so they can find recovery. It does fly in the face of some of our accepted wisdom about abstinence and where people need to go, but it's reality based, especially with the epidemic of overdose that we're seeing with fentanyl. And so I think, introducing these public health ideas to social work can also help create those spaces. That's just one example. There are plenty of other examples, whether you're looking at community violence, gun control. The public health viewpoint on these things really resonates with our social work values in so many ways.
Absolutely. Thank you for that, Dr. Zelnick. And I know we're coming close to time, but I know you also mentioned there was another passion of yours that you talked about briefly earlier, and that was the quality of work environments
Mhm.
and outcomes for service providers and recipients. And I'm wondering if you can speak to that. What does it look like? How does the quality of work environments impact outcomes for providers and recipients?
Yeah, I mean, I think at the most immediate level, we know that if you're accessing social services and you are the client or family that walk into an office, and if you walk into a place that is clean and welcoming, where people have time to listen to you, where people are friendly and treat you like someone of value, even though you're going through something tough. Um, if you're able to see the same provider week after week, or have your needs met that way, you don't feel like you're on an escalator, having to cycle through. That is the kind of service that we want to provide for people. And from the point of view of the worker, if you know that you're valued at your job, if your own child becomes sick, you can take the day off and do what you need to do for them. If you know that your supervisor is going to help you understand your cases and not present you with a bunch of numbers like, here's your caseload, you need to cycle through, get people off the caseload 30 days, these successful outcomes, this treadmill that we can be on because of the way things are contracted, that you will have a happier worker. A happier worker is a key ingredient to the health and well-being of clients. This is what we're giving them. We don't have any other inputs into our services except our skills
Mhm.
and ourself and our agency and our environment. But there are a lot of things currently that contradict that. And for me, over my career, that has really come up against, I would say, the logic of social work versus the logic of the market. So to the extent that we let a business model drive what we do, we may be suffering. If we're prioritizing productivity, accountability, efficiency, keeping that contract over what we know clients need, we're sometimes in trouble. And I think those are the factors that led me to be interested in work stress, how work stress harms, particularly women and people that provide social services, and how we end up in our field. We don't get paid enough as social workers. We have a lot on our plates. We are just constantly
Mm.
coping with systems that don't see the world the way we see the world, but we put up with it because we are trying to be there for the clients, and we're trying to bridge a gap between what exists and what should be. And so I always, my students are always like, no, I'm not going to work in that kind of agency when I graduate. I'm like, you will.
Yeah,
You
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 will.
will work in an agency where
Yeah.
there's a contradiction between what you're
Mhm.
trying to give and what they're willing to pay for, and we need to figure that out. But through policy, we also need to work on improving investment in the services we know people need to live healthy, productive, and happy lives. And social workers need to be part of that too.
And I love what you said, Dr. Zelnick, because that contradictory part that you talked about, or I like to sometimes refer to it as a paradox. The paradox is you're working in these systems that you're expected to be a savior in, but you're also
Mhm.
susceptible to a lot of the oppression that you're working through. And sometimes it can leave you with a sense of helplessness that
Right.
things are not going to change because you're trying to create change, but you're trying to create change in an equitable system. And so how do you do that? And you talked about that, right? I think you do it in multi levels, but
Mhm.
policy is important. Political process is important, so that we can really see change in these systems. And so I wonder if you can speak a little bit to that. And that final question: how do we engage social workers more in the political process so that we can really dismantle this controversy and this contradiction that we're expected to live in? That's just, it doesn't make sense. How do we engage social workers more in the political process?
Yeah, I mean, I that is my job. That is what I love doing. I have always seen my role as bringing a political lens to social workers because a lot of social workers are like, no, 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 I don't like that. I don't
Yeah.
want that. Okay, fine, but it is part of our identity, right? So, I know I met you on the campaign trail when you were running for city council, and I think that's one prime example, right, of having social work leadership in policymaking. At the city level, at the state level, we have many wonderful social workers in office in Albany, also social work staff members, social workers who have become staffers in those offices, who have become lobbyists in various ways. So filling these policy responsive, situations. I think what we're doing right here is policy, right? Is like bringing a bigger view into what social work is and how it connects to bigger changes that we're trying to make. Every student has the opportunity while they're in school to take the social welfare policy classes and to be introduced not just to analyzing policy and the history and politics, which I think is important, but also to understand that particular social work view, which itself is a paradox, right? We believe in both what some people would classify as a left wing and a right wing idea, right? We believe perhaps from the right that individuals are responsible for their own place in society. But from a social work view, we believe that people can change, that people can become empowered and have agency and make change. But we also believe, this may be the left wing view, that there's structural forces out there that constrains people's changes, that may need to be changed, that may limit that. So, we don't have to fall into the political divide that's out there. We can believe both in the person and the environment and making changes on both that level. And I think that's really the beauty of a social work policy view, is that we're not going to disregard the individual and what they're going through for a bigger advocacy cause, right? And at the same time, we're not going to blame the individual for their situation, and we're going to look at policy solutions that change the structures that govern people. And so it's complicated, but I think, so I'll just say one last thing. The thing the students love more than anything are actual policy practice experiences while they're in school. So we're part of the lead trip every year going to Albany, Legislative Education Advocacy Day. We need more
Mhm.
things like that in the city council, in the local district office, at the community boards, and where students can see, oh, my viewpoint matters to people. I have something to bring. People care about the frontline view of a social worker when they're making housing policy, when they're making substance use policy, because we bring the actual stories and we know the nuance of what will work and what won't work. So I just want to encourage anybody who's watching this, just if you work in mental health, if you work in substance use, sign up for the listserv, become active in the policies in your community and in your state that govern those things, because you have a message that is often on behalf of people who don't have a voice, to really, bring those issues to policymakers and help develop policy that will work for our clients and communities.
Incredible. Thank you so much, Dr. Zelnick. And there are so many things I was thinking when you were talking, and we don't have time to say it all. But I think the three things that resonates with me are this: number one, social workers belong in public health. Number two, social workers belong in the political process. And number three, social workers belong in power.
Yep. I couldn't agree more. And that's why I'm so grateful for your leadership and all the different things you do. And I can't wait to see, what you do and achieve in the future, because I just, have really valued meeting you and so excited by all of this. So thank you for inviting me to be part of this chat.
Absolutely. Thank you, Dr. Zelnick, and admire you. I want to openly thank you for just supporting my campaign when I ran for office a few years ago. It has been life-changing, and I think it's so special when you have another social worker by your side, and that's a woman, and that gets it. And so that has been very life-changing for me, and I really appreciate you. So thank you for your work. Thank you to Touro College, and for all the work that you guys are doing out there, and for all the schools of social work that's in this fight. We're all literally in it together. But I think the future of social work looks a lot brighter. And one of my passion, and I think you share that passion, is getting more social workers involved in the political process and in policy, because we have to say matters, and we absolutely deserve to be in these rooms where decisions are made.
Absolutely. Not just deserve, we need to be, to
We need to
change
be there.
the things. So no, I couldn't agree more. Couldn't agree more.
Absolutely.
So,
Thank you, Dr. Zelnick. How can people reach out to you if they're interested in your work or hearing more or getting connected?
right. So, you can find me at, my work email, jennifer.zelnick@touro.edu, or, our school's website, gssw.touro.edu. I'm a little bit social media underrepresented, but those ways will work. So thank you.
No worries. We appreciate you, Dr. Zelnick. Thank you for sharing this space with me. It's been absolutely incredible. So I hope to have you back in the future. Wish you an
Thank you.
incredible day. We'll be in touch, and we thank you all for watching and for connecting with us. Thank you so much for your just your engagement. We saw some of your comments out there. We'll be sure to respond to them later on. Let us know your thoughts. Let us know what you're thinking and ways that we could better support the content that you want to hear as well. Again, don't forget to follow us at www.iraceinc.org and iRace.org on all social media platforms. And lastly, we are launching our executive coaching program. So for our teens and young people between the ages of 11 and 19 years old, if you have a passion to start a business, we have career mentors that are going to invest in you. They're ready to pour into you. They're ready to pour into your children. And so if you're interested, you can learn more on our website. And then to our schools that are interested in mental health services, we're opening up for the 2024 to 2025 school year. So if that is you and you need additional support and building out a wellness environment, we have an integrative mental wellness program that will support your school if it is a good match. So reach out to us at info@iraceinc.org. Thank you all so much for joining us. We'll be back next week. Stay tuned. Think we're a little over, but yeah, I think we're a little over the live. And again, thanks, Dr. Zelnick. I truly appreciate you.
No
And then
I'm
maybe we
sorry
can,
I talked too much. I was,
no, that was incredible. And maybe we can talk more about the South Africa piece
yeah,
later on. I don't know if you still have like trips that you do over there, but I definitely would love to connect with you about that as well. More.
that sounds great. Yeah, no, that sounds great. And the other thing is that our team, has multiple different disciplinary people on it. It might be something some students are interested in getting exposed to, opportunities. Um, our team is like medical students to, fellows and interns, residents, social workers. So it could be something really interesting.
Yeah, that's incredible. And I guess I'll email you and talk to you offline about it. Some of my international work and future endeavors. So I'd love to connect with you outside to learn more about
Okay,
that. Thanks,
sounds
Dr.
good.
Jennifer. All right,
Okay,
have a
bye.
good one.
You too.
Bye.